I was a receiver, you're a defensive lineman. Couldn't be more different. But, in order for the team to succeed, I have to trust that you're doing everything you can on your end of the ball, and you're going to trust in me to do the same thing. So if somebody shows up late to practice or, not responding to emails, how can you trust that that job is going to get done, right?
So happy to have you on the Tanner Bengu Sports to Business podcast.
There we go. Thank you. Happy to be here.
Awesome. I know, we were just discussing, like, it's been 10 years since I saw you. It's time flies, right?
It's been a while. Yeah, every time you think things are going fast, you take a breath and realize that it's been 10 years since you graduated undergrad, and a lot has changed. Yeah. But one thing that brings us back together is football, for sure.
Exactly. So a quick introduction for everybody who doesn't know who Alex is. Alex was an all-star football player at McMaster, went on to med school. Long story short, and I'm going to let you introduce yourself and do justice. Long story short, he's now a full-on, working in a clinic, and you're working on the squad of some sports teams. Yeah. And you're doing a bunch of other stuff where research and, groundbreaking discoveries as well. So a lot going on in your life. So tell everyone what you're up to nowadays, Alex.
Yeah, sure. So I'm just over 1 year into independent practice. My official title is I'm a primary care sport and exercise medicine doctor. So I work at the Cleveland Clinic Canada and a few other clinics around the city. This past year, I was the team doctor for the Toronto Wolfpack, which is a professional rugby club here in Toronto. Unfortunately, because of COVID, they've had their season suspended and their operations. So hopefully they'll get back into it next year. I also work up in the emergency department up in Port Perry, which is a small town about an hour north of Toronto. I've done a bunch of different work with a variety of pro and amateur level stuff, from NHL referees to my fellowship. I was at the University of Toronto, so I covered football games, basketball games, hockey games, things like that. Done some work with Canada basketball, and also covered some like endurance events, so marathons and some concerts and things like that. Yeah, so it's been pretty busy. Finally, also involved in kind of what's called free open access medical education. So it's a website that some of my mentors have put together, and I've jumped on during my training. So we provide medical education for people who are interested in sports medicine and want to learn a little bit more about it.
That's amazing. Like, that's so much. You're doing so many different things. How do you find the time for everything? I know you recently moved as well, so how do you find the time for all this? I know being a doctor is not easy, right?
I know it's tough. I think one of the things that we try to pride ourselves on as people who do a lot of different things is time management. And sometimes that's easier said than done, I think. But a lot of the times, it's basically just making a to-do list and trying to check things off and knowing kind of when you're busy and when you're not, and sort of prioritizing things and trying to do there. Yeah.
It's execution over, analysis paralysis, they call it.
Yeah, exactly.
Yeah. I'm actually very excited to learn about all the great things that you went on to learn, and some things that you can even teach me on this podcast about leveraging sports, plus even some of the advances in sports nutrition and sports the medical side, and how people can apply it into their professional lives. Before we do that, I really want to understand, Alex, from you. You were a McMaster football player, then you went on to med school, and then you went on to do all these different things. How did your football experience in your undergraduate studies prepare you for the journey you've been on in the last 10 years?
Yeah, I mean, it's good. It's a good question. I think, I've always said that football and it's said a lot, right? Football is a metaphor for life. I think a lot of the struggles that you go through as a football player really help in med school. I would say, when you start off in high school, you're usually the superstar of your team, and you come in and you're a rookie again, and you got all these guys that you're trying to look up to and people to impress. So it really, really tailors itself into medicine as well, because you start kind of low on the totem pole as a medical student. You want to prove yourself day in and day out by working hard. And so you kind of go through there. So that's one way that it helps with football. I think the one thing that I definitely learned during undergrad that helped me during medical school was time management, as I kind of mentioned before. So, I took a full course load during football season most of the time.
You had
So
5 courses a semester?
so 5 courses a semester. That's class, most days 8:30 to 3:30. That's practice that starts at 5.
Yeah.
So
Now I remember you were a scholar as well. Were you? I
yeah,
remember.
Honors Scholar.
Yeah.
Yeah, for
Wow.
sure.
So for everyone listening, what is that? What did you take to get on that list?
So Marauder Scholar, you have to achieve. You have to be um, academic scholar. So I think you have to achieve. I can't remember what the grade point. I think it was 9.
Like 9 or like
9 out
85,
of 12 or
90.
something like that, and still be.
With 40 hours of football.
Yeah, and then I was academic all Canadian a couple of years too. So going from that, full course load, and then having to be ready for football. I remember, I still do this to this day, and did it all through med school. Was literally like 10 to 15-minute naps. Get home,
Wow,
try and sleep for a little bit, get something in, and then have a coffee or whatever, and head on over to DBAC.
that's amazing.
Get ready
That's
for
amazing.
practice. And so yeah, I think that was a huge thing. It was always trying to balance it, and I was definitely somebody who, I knew I wasn't the biggest, fastest, strongest guy on the team, but I knew like if I had, if I understood the game and understood the ins and outs of things, then I could leverage that to my advantage and become successful on the field despite
Exactly.
other things, right? Yeah.
I think you hit on a great point there, Alex. It's about, you get a lot of players I've seen had amazing talent, but they never used it to their advantage because the work ethic wasn't there, right? So I think almost when you're not athletically gifted in a way, if you learn how to really use the other things that are free but hard, such as work ethic, understanding the game, learning the game, showing up to practice early, right? All those things eventually add up. And like one of the things that I, even back then when I knew you, I knew like no matter what you go on to do, you're going to be successful is because of the underlying principles you had built.
Yeah,
right?
Sure, yeah. I think that lends to anything, right? I remember like Coach P used to say, if you're not 5 minutes early, you're 10 minutes late, type of thing.
Exactly.
And that follows you everywhere you go, right? Like, and those are habits that you have to build early on. And if you don't, it's gonna hinder you back in the day. I mean, even as a physician, and I've been in positions in leadership in medicine as well. People that are late when they're in high school to class are going to be late to meetings when they're adults. That's just something that is carries
really a part of you.
Exactly. So that's where that discipline and like determination really comes in. Things like that. Yeah.
So why did you choose sports medicine?
Yeah, the obvious choice is, I was an athlete, so I like sports. But I think for me, it probably started back in high school when I was in grade 12 in our final like Metro Bowl game, which was, I guess, the equivalent of a state or provincial championship. I dislocated my shoulder like in the final game at the Skydome. They popped it back in. Long story short, ended up playing the second half, scored the winning touchdown of that game. Went through rehab a bunch, and then sort of dealt with injuries all through university, both shoulder and other sort of things. So spent a lot of time in the physio clinic, volunteered in the physio clinic, that sort of stuff, and really connected with that process of getting somebody back
from the field
onto the field, and really feeling good about it when you see them succeed. So that, and like I really enjoy the human body and how things work, and training and eating and all that sort of stuff. So that really blossomed into that, and I think getting into medicine, family medicine was something that I really enjoyed, because it's kind of like that holistic sort of approach to things, and understanding the patient more than just their pathology. It's the patient that you're treating, not just the disease or the injury per se. So I think again, being an athlete, being on that other side, I'm able to connect with guys or not just guys, patients and players, and understand, the pressures from coaches, pressures from parents, and really connect with them. And even just using terminology, hanging out at U of T or being in the U of T clinic, you talk to the football guys, hey, when did you injure yourself? Was it during one-on-ones? Was it during, 7-on-7? Was it during Skelly? What part of the practice did you get injured? And they sort of connect with you on that level. So it kind of helps them buy into the rehab and buy into the recovery.
That's actually that's so unique and interesting, right? Because I was okay for 2 or 3 years after graduating, from football. Some of the injuries started coming back after, right? Because I did lose some weight and I was okay, but the stuff started creeping back up. The shoulders started hurting again, knees started hurting again, all of them lighter. And I mean, I went to a lot of doctors, but I just knew that they didn't understand where I was coming from. Because they weren't sports, they didn't understand the sports side of things, right?
Yeah.
And then finally I met someone who is a sports doctor and works with some of the professionals. And right away, he's like, this is what's wrong with you, and here's how you're going to fix it. And because you were a lineman before in university, here's all the things that, probably went wrong. And I'm like, damn, this guy gets it.
Yeah.
Right? And and it's not just, from a mental standpoint, I'm a lot more positive about the treatment because I know that the person working on me he understands where I'm coming from, right? So, huge plus.
Yeah, I agree for sure.
Yeah. So, I mean, you're working with all these different teams now, and tell me a little bit about what kind of work do you do as a team physician? So what does your day look like? What does your season look like?
Yeah, I mean, it's definitely, it's variable depending on the time of year. I would say on a regular day-to-day, I'm in clinic, and I don't just see professional athletes. I see people like you and me. So people that are every day, trying to be active or have injured themselves doing recreational sports. Also seeing sort of people that are a little bit older that have osteoarthritis and are trying to deal with that and trying to stay active and avoid knee replacement surgery. So that's typically a day-to-day. And then, week to week, I'm in the emergency department. That's kind of where else I'll be. From a team physician perspective, it depends. So with the Wolfpack, you're dealing with mostly a lot of day-to-day medical stuff. That's actually not even mostly sports medicine. It's just regular medicine stuff. If they have a skin infection or, before COVID, a viral infection or something like that. Also, when they're here, we deal with their families. So, seeing their kids or their wives or partners or whoever is over here. So dealing with that sort of stuff. Also, variety of mental health concerns that, players have is really important. And then with injuries, we definitely work in a team environment. So your team meetings with your physiotherapist, your strength and conditioning coach, the head coaches, and sort of figuring out where guys are in the rehab. Do we need to get imaging? Do we need to schedule MRIs? Those sorts of things.
It's amazing. You mentioned something which I really want to dive into. You talked about pressures on players. Walk me through that. I know, like when we were playing, there's always this pressure that we're being watched all the time.
Yeah.
You don't want to be the one on the field, right? How do you handle that aspect of it when you know that you want to get this player on the field and somebody might be like, I'm ready, but they're not ready?
Yeah, no, it's a good point. I mean, especially in, the types of sports that I'm covering. And I think most sports in general, it's as much as we talk about it, there is still that tough guy attitude, and we want to push through injuries. I think a lot of it really just goes back to that you have to sort of distance yourself from that, and you realize that, you have an objective point of view as the physician. And although that the athlete at the time may not fully understand the decision that you're making, that you ultimately are doing what's best for them, and not only what's best for them at the time, but also what's best for them in their career going forward. Because a lot of the times, you're in that, you've been there, I've been there. I got my shoulder dislocated. Should I have went back in? Probably not. You know what I mean? But
exactly.
And you see it all the time in athletes. Got like Kirchilli and all these guys that are playing with big time injuries. So yeah, it's definitely not easy. Sometimes at the end of the day, if depending on the situation, you know, if their guys are making multi-million dollars, and then as long as they understand those risks, then those are the risks that they're willing to take, then that's kind of where you go. But yeah, from a more like amateur perspective or university or things like that, you really need to distance yourself and understand that, you know, you're a trusted member of the team, and you kind of fall back on your medical training, your medical expertise, and say, okay, no, this is the right decision that I'm making. Although you may not, the coach may not like you, the player may not like you, but that's kind of just what you got to do as a professional.
Yeah, you almost have a duty to your profession.
Yeah.
To that for, and you see the something that the individual at that point might not understand, and something a lot bigger, right?
Yeah, exactly. And so, yeah, and like I said, ultimately you're doing what's best for the patient, and that's kind of the most important thing.
We're curious to know, Alex. When the game's on the line, players making a lot of money, you want to go back in, they understand the risks, right? I think with COVID, and I mean, I've been in the corporate life, and I've seen a lot of my colleagues, and even sometimes myself, is like, I just got to do another couple of hours. I got this big deadline I got to hit, huge project I need to make sure that I'm delivering on, right? And a lot of times, eventually, like, you start getting stressed out, and your body starts to give up on you, right? And sometimes if you don't sleep enough, you don't make the right decisions at work. What would you say is one, like, a couple of things that maybe you've learned in sports med and from sports, from some of the players, that business professionals can use to really listen to their bodies, even though there's this work's always going to be there, right?
Yeah.
So, like, how do you handle pressure and still make sure that you're healthy while doing it?
I would say, I mean, it's going to go back to that same sort of, I don't want to say work-life balance, but more so just balance. I don't think it has to be work-life balance, because work is your life. They're not.
It's an integration, right?
Yeah, they're not two separate things, right? I think, staying regimented as best as you can when you're in those sort of tough things, and having those daily outlets. So whether that's, whatever that is for you, whether that's going for a run, whether that's, waking up in the morning and doing a yoga, or like getting 10 push-ups in or something like that, or even doesn't have to be physical. For me, it's mostly physical. Like, I know, like you just said, like sometimes when back in med school and stuff, when you're studying and you're doing everything, you don't work out, you actually feel worse. And then you go work out and you're like, man, why haven't I been doing this for the last week, right? And so I think it's making sure you have those outlets. And like I said, they don't have to be physical. It could just be, calling your parents or calling a friend, and just sort of venting or talking about something else other than sports, I think is important. And really just using that as having an outlet. I think you see that in pro athletes too. Like, guys can't be going go all the time. And I remember, especially with the Wolfpack, a lot of these guys they're overseas, they're over here for 4 weeks straight. They haven't seen their family, they haven't seen their wife or their girlfriend or their partner or whoever. So they're like, I just need a bit of a break. I got to make sure I call and check in and see how things are doing. And I think that's important no matter what walk of life you're in.
I think the key thing here is that we start to think that all these things that we have throughout our life is kind of like anchors, that those are things we can sacrifice to do something which is pressing. But a lot of times what people don't realize is that those are the things that allow you to do the work.
Exactly.
And effectively and efficiently and productively, right?
Yeah, it's like that. It's the good passion versus the bad passion, and I think it's a fine line between the two of them.
Yeah.
Because you can be super passionate. If you want to be super successful, yeah, it's going to require you to make some sacrifices. But at what point do those sacrifices become, from a medical term, pathologic or detrimental to your success? And at what point do you find that balance where you can be focused on what you want to do, but also understand that, you can't do it all the time.
Turning this sideways, what are some of the things that you've seen, either your colleagues or even some of the folks on, let's say the basketball teams you've coached, the rugby teams you've coached, what are some of the great values that you've seen some of the players exhibit that you're like, man, that's a very smart thing this person does, and that's probably the underlying X factor that allows them to perform at such a great, rate?
Yeah, I don't know. It's a good question. I think a lot of it is kind of, I don't want to keep going back, but I think like mental preparedness and understanding what you need to do. I think it's working hard. And the other thing is focus too.
Can you tell? Like, my question is, can you tell the players that work super hard versus the ones that don't, from the outside looking in, or the preparation?
From preparation, yeah. I mean, I think it's everybody's a little bit different, but those guys that are focused and zoned in and kind of know what they want to do.
Yeah,
And then there's guys that may not be as serious about it, or again, same sort of thing, showing up late to practice, or or getting in trouble off the court or off the pitch. Then that those aren't the greatest habits. So it definitely permeates. I think like
yeah.
you're talking about those habits that you develop permeate throughout all walks of life.
And the reason I wanted to ask this was because a lot of times when in business you're interviewing people, I always advocate that look at the habits versus the interview. So look at what does this person do before the interview if you're trying to hire someone, or after. Do they show up early? Are they prepared? Do they respond back in a timely fashion?
Yeah.
Those are the things that, again, allow you to see, it might not be very correlated in a positive manner, but it has some sort of indication
Of course.
this person has the right values.
It's trust, right? Like it's like anything, whether you're in business or in sports, especially in football. We played on opposite. Me and you couldn't have been more different. You know what I mean?
Yeah.
I was a receiver, you're a defensive lineman. Couldn't be more different. But in order for the team to succeed, I have to trust that you're doing everything you can on your end of the ball, and you're going to trust in me to do the same thing. So if somebody shows up late to practice, or not responding to emails, how can you trust that job is going to get done, right?
Yeah.
And the same thing goes in medicine, or when you're working on on teams, you got to have trust in that physiotherapist, or that strength conditioning coach, or if you're in a hospital, the nurse or whoever is part of that team. Everybody's a valuable spoke in that wheel, right? And it doesn't go unless you all are buying in.
Exactly. And then also, if you do know that you have a teammate that's not pulling their weight, having the ability to call this person out, and knowing that it's a tough thing to do, but it's the right thing for the organization.
Mm-hmm. Mm-hmm. Yeah, no, that's a good point too. Yeah, definitely.
That's very hard to do, but because you don't, I don't want to ruffle some feathers. I don't want to come across as personal, but for the greater organization, I think that's something you have to do.
Yeah, I think it's understanding it, right? Like if you take it personally, then okay, maybe this isn't the spot for you, or you gotta find somebody else.
Exactly.
Yeah.
You said the word, was it pathological?
Yeah.
So I'm actually curious, Alex. I'm really interested in this. Tell me about some research that you've done that's just fascinating. Anything.
I would say a big thing, and this is even really not really medicine. I mean, it's still medicine, definitely medicine. I think a big advocate that I've been, and I have a lot of friends and colleagues that are doing good research in it, and there's good books, is really just the effect of physical activity on sort of what's called neuroplasticity, or so basically developing new brain cells and new neuronal connections to help with learning. So there's a lot of evidence that you go out for a run, or a 30-minute run or something like that, and then you come in and you do some reading, or you try and learn something new, that it actually strengthens those connections. And I'm a big proponent, again, throughout my medical career, is really physical activity as a form of medicine, or exercise as medicine, which is a big national and international component.
Wow.
So knowing that first line treatment for a variety of things, not just sort of musculoskeletal stuff, but diabetes, depression, Alzheimer's, high blood pressure, cancer, all sorts of things, right? We know that physical activity is the number one best thing that we can do. And if we could harness that in a pill, it would be the most successful drug on the market, without a doubt. So,
wow.
that's probably the biggest thing that, it may not be groundbreaking to some people listening, but it's actually the most important thing that you can do. And it doesn't even have to be a lot. Like it's going out for a 30-minute walk 3 to 5 times a week. And that's it. Yeah.
I mean, like it's so fascinating that if you go and do a 30-minute run, you come back and you try to learn something, you're saying you can develop new brain cells.
Yeah, exactly. New neuronal, new connections. They've done lots of studies where the exercise actually increases a certain protein in your brain that can help actually grow new neurons.
Wow.
So they did like back in, I think it was in Chicago. So one example that I always use is there was one school that before they started class, they would run a mile and then go into school. And that school had some of the highest testing scores in the entire state, solely based on that. Yeah.
It's absurd. That's almost like, it's almost unreal.
Yeah. It seems like it's like not even fair, right? Like there's
Yeah.
so much easy stuff that you could be doing. And so why not, right? Like just go out and do it.
Wow.
Yeah.
Wow. That, I mean, I always, and this is something that I think like the older I get, the more it becomes obvious. If I don't work out in the mornings, and I started doing a lot of HIIT training, right?
Yeah.
If I don't work out in the mornings, exactly. All the football players, right? After you retire.
Time.
Exactly.
Yeah.
I go in 30, 40 minutes, go really hard. If I don't do that, and I have a really strong, like a big meeting, I have to make decisions where I have to present, I've noticed that my performance, number one, is not as great as it can be in days I work out. And number two, I find it really hard to speak and articulate what I'm thinking.
Yeah, definitely. I agree completely. Like I said, I think there's so many times where I mean, school, work during residency, you get busy, you're on call, you're working, 78 hours a week, maybe more, and you don't get to work out, and you're like, am I feeling sick? What's going on? And then you hit the gym, and like you said, you go for a quick workout and you sweat it out, and you're like, man, that's what I needed. That's
exactly.
Yeah.
That's amazing. I mean, I've been down the path as well, where it's like I keep working, and I'm looking at a list of stuff to do, and it's just not getting done because I'm pretty much burned out. Yeah. And I know I should go and do something else. I know I should go for a run. It's going to help, but I just can't get myself away because I'm like, I need to do this, but it's unproductive.
Yeah.
Right.
But then you think about it, but then you got to sort of justify it to yourself where, okay, if I take this time now for me, I got to go for my run, and then I will be more productive. That's usually what I say. It's just like, I'm not, like, you kind of hit that wall, and although you need to do it, in the end you're going to be better for it.
Exactly. And I think the big misconception in today's, unfortunately, especially with COVID, is you got to keep working, you got to keep grinding it out. I think, like for everybody listening, the message is, and there's research behind it, is that when you hit a wall, you have to stop, do something physical. It can be a walk or a run or a workout, whatever it might be. It's actually going to allow you to be more productive and happier. I think a lot of people are unhappy right now because you keep on doing the exact same thing day in, day out, and in the same place you're having dinner.
Yeah.
The other thing I really wanted to ask you, Alex, was also like for anybody who is, let's say, a football player today, and like a lot of young athletes talk to me, right? And I'm sure it comes with you as well, where it's like, I'm like 10 years pre us, right? Today is young players who are in university, any sport, right? And they're like, yeah, we're grinding it out, trying to make the big leagues, but the 5% rule, only 5% are going to make it, and of those 5% are going to actually stick around, right? The big leagues. For everybody else, like, what is something that these athletes should be thinking about today so they could go on to build careers, right? Such as become a doctor.
Yeah, I think a lot of it is that you need to understand why you're in sport and what the values are behind it. Understanding that, like we've spoken about during this podcast, is the lessons that you learn definitely do translate into success, and to understand that there is life after your sport, and you need to prepare for that. And although everybody wants to be a professional athlete and everybody wants to, score the winning touchdown, things like that, the majority of us don't. And putting in the work to prepare yourself for that, whether that's off the field, or on the field too, right? Like those, like I said, working hard in the weight room and things like that are going to translate into those other things. And it's really understanding the process that you're going to get there. And I would say, if you're trying to, accomplish something new in your career or making some sort of transition, just like making sure you take the time to sort of discover like what your motivation is and why you're doing those sorts of things.
Yeah, and like the people who actually go on to play professional sports, I think the misconception is, people think once you make it, it's amazing. Like the average lifespan of a professional athlete is like what, a year and a half?
Yeah.
right?
Yeah, I mean,
And
I think that's the thing. I think you gotta block out distractions. I think is another big thing. You're in university, you're getting pulled many different
many
ways,
directions.
socially, emotionally, physically, academically, everything. Like I remember, I used to get razzed for studying on it all the time and things like that. And I was just like, listen, I know that football is not my be all and end all, and I gotta be ready for when that's there. And I think that translates to medical school. Even in medical school, I remember people being like, "How are you still studying? How are you still doing this?" And it's similar to when you're working out, or like how are you doing that last rep, and you're just like, I don't know, I'm just doing it because I have to do it to get it done, right? Like that's all
Yeah.
is just working hard all the time. So I think that's like taking those lessons and understanding how you can translate them into other aspects of your life.
So they're so motivational. That's I think looking at understanding like there's a long-term game plan, and as long as you know that inside your head and you're true to that, it's going to be much harder for somebody to sway you versus if you don't know where you're going, if you don't know what the long-term plan is, right?
If you're there, you gotta, you're gonna go through those ups and downs and understanding sort of like
Yeah.
why you're there and how you're going to achieve it. And then it kind of motivates you in those valleys to get where you need to be.
Yeah, and it's like when you are in university, right? Like I think in the same topic, and this is actually something that I always wondered, because what worked for me might not work for everybody else, right?
Yeah.
How do you block out the distractions other than just knowing that you have to get somewhere? Like, what's one tactical thing you did?
Yeah, I think well, back in university, it was tough. I mean, even now it's probably way harder. I find
Yeah,
to shut things out. Back then we didn't have Instagram, or we had Facebook. That was pretty much it, or some text messaging. But yeah,
that
I
was
think
also on a laptop.
yeah,
It wasn't on the
exactly.
phone, right?
Yeah, exactly. So what I used to do, I really used to just, I think I had a few spots on campus that I would go to, throw on my headphones and really just get down to work. I think having a support system is really important. So, I always knew I could call my parents or my brother or whoever and just sort of talk about things. And then also having a close knit group of friends that say, hey, let's go study, or let's go somewhere and just sort of zone out for a little bit. And what didn't even have to be studying the same thing, just go in and do work, right? I think that those are some tactical things. And I think just really prioritizing, like writing down, okay, I'm in class here, and then from this time to this time I'm going to study this, and this time to this time I'm going to study that, and then kind of going from there.
So I think make your schedule and put time slots on it. Just because you have 5 hours in the evening doesn't mean you spend the entire 5 hours sitting in front of a laptop, because then you're
Exactly.
never going to get done, right?
Yeah, exactly. Yeah, you got to put some time in, and whether it's, going upstairs or hanging out or whatever. Yeah.
And then I think the second thing that I think you said that I resonates with me, and I've been through this as well, is stick with a group of people that actually support you and motivate you. Don't spend your time with people that actually pull you down.
Yeah, definitely, definitely. I think that's important. And a lot of guys that I made friends with in university are still some of my very close friends today, and we share a lot of those same values. So it's good, and that happens in all walks of life, right? Um, yeah.
Well, Alex, it's so good to see you doing well and thriving and making such big moves in the medical and the sports med field. So great to connect with you again. How can people find you online? Where can they come and check out your practice?
Yeah, sure. So if you're in Toronto, you can come see me at Cleveland Clinic Canada. It's Yonge and Eglinton. You don't need a referral to come in and see me if you have a sports injury. If you want to reach me on Twitter, I'm Alex_MD4. Those are probably the best ways to reach me. I'm not super active on social media, but I'm definitely there. I'm usually tweeting about the Raptors or something like that. But I'll feel free to reach out. I'm happy to speak to anybody who needs any help and any sort of career advice. And I think a lot of it is happy to do what you're doing. I think a lot of it's giving back, right? Like we've had
Exactly.
a lot of people kind of help us get to where we are today, and I always love helping other people and trying to impart some of the knowledge that I've developed over the years onto people, and hopefully it can help them become successful too.
100%. And I think, when in my rookie, I remember you going out there and just running routes, and you're one of the people I looked up to. So, I mean, work ethic wise, and, you were one of my role models there as well. So, great to connect with you again, Alex. And all the best
Appreciate
in the
it.
coming years.
Thanks for having me. We'll talk soon.
Awesome. Thank you. Team, remember to like, subscribe, and share with a friend, and visit tambourvango.com for a ton of free content and exercises.